As has been mentioned, we do in fact now have 19 cases of COVID-19 here in Illinois, and unfortunately we expect and anticipate more. We are reporting the first cases outside of Chicago, outside of Cook County, both the Kane County resident in her 60s and a McHenry County resident in his late teens. Neither have a travel history to affected countries or close contact with a known COVID-19 case based on our preliminary investigations, but the investigations are still ongoing. Public health officials are investigating the travel history of all the new cases, as well as any known close contacts with a known case. So all the new contacts, all the new cases are in isolation, either at home or in a hospital, and are doing well. There are indications that some of these new cases may have acquired the virus within the community, and we are diligently pursuing that information. Public health officials will reach out to any close contacts of these cases as quickly as possible. Yes, I know people will be concerned that they see a youth in this new identification of cases. Although we do have younger individuals, based on what we've seen in other countries, the virus appears to show more severe illness in older adults. For this reason, we are asking our older adults to limit their activities in the community, especially large indoor events. We are also recommending long-term care facilities and nursing homes to restrict visitors under the age of 18 and those with obvious colds, influenza, or potential COVID-19 infection. Staff should also be screening all employees as they come in for symptoms of fever before starting their shifts. As we have been saying for days, even weeks, we want everyone to start thinking and preparing now for the virus to circulate more widely in the community. Social distancing will be important to slow and reduce and dampen the effect in our community. This may include canceling large events. It may include limiting going out in the community. Working from home, if possible with your job, is another option that might be employed. Spread in the community, similar to what we've seen around the world, will definitely cause disruption to our daily lives, so we can minimize that by putting some plans in place. So we want people to think now about how that will look in their daily lives or in their homes and communities. Resources to help you plan some of those contingency plans are found on the IDPH website at dph.illinois.gov. Again, our 3 laboratories here in Chicago, Springdale, Springfield, and Carbondale continue to test for COVID-19, and we are looking both for individuals who are symptomatic and meet our PUI, persons under investigations definition, but also collecting samples from the 15 surveillance hospitals across the state. Local health departments are not able to provide testing for COVID-19. So please contact your healthcare provider if you have questions or concerns about a possible exposure for yourself or a loved one. We do encourage people with general questions about COVID-19 to call our hotline. That number again is 1-800-889-3931. This hotline, however, is not to assess a person's individual symptoms. So again, if you have symptoms or you think you've been exposed, please contact your own healthcare provider. As the governor already stated, the state of Illinois will continue to use every resource, every single tool available to respond to this situation, and we will continue to work in lockstep with our local health departments and other state agencies to effect the best possible result for the people of Illinois. We will continue to keep you abreast of all positives as we learn them, and in the meantime, please don't get tired of hearing this. We're continuing to recommend the everyday health actions to help prevent yourself and others, especially our most vulnerable people, from becoming ill and spreading germs. So continue to wash your hands, cover your cough and your sneeze, stay home when you're sick, disinfect surfaces that are touched frequently. As mundane as this sounds, this will help dampen the overall effect of this virus in our state.